My name is Dr. Joel Collins, clinical haematologist and practice principal of the Iron Infusion Clinic. So, iron deficiency in pregnancy is a really interesting and quite a big problem. Of all the times when a woman may get iron deficient, pregnancy is the most common and largest situation where the woman's body requires a lot of iron. To the point where 80% of all women during pregnancy will become iron deficient throughout the process of pregnancy. The reasons for this are that, one, a lot of women go into pregnancy already having somewhat borderline or low iron status. However, even for those who have perfectly normal iron stores leading into pregnancy, pregnancy places significant stresses on the body's iron stores for two main reasons. One is you have to grow a baby, or that requires a lot of iron. Two, throughout the pregnancy, women's blood volume increases by 30 to 50% at the tail end of the pregnancy, and women need a lot of iron in order to make this blood. The end result of all of this is that during the second trimester of pregnancy, your iron needs increase by 200% of your non-pregnant baseline and by 300% in the third trimester. The end result is a number of women become significantly iron deficient throughout their pregnancy. Interestingly, a lot of the symptoms of iron deficiency in pregnancy are what women would normally be told are normal symptoms of pregnancy. And in fact, they are very common symptoms of pregnancy. However, a lot of these symptoms are probably related to iron deficiency. So I'm talking about fatigue, headaches, restless legs. However, pregnant women in particular get less in the sense of restless legs and certainly a lot more of leg cramps. Now, fixing women's iron during pregnancy improves these symptoms for women, and that's really important. In addition to that, the stakes are even higher for fixing iron deficiency in women. In particular, we know that if a woman's iron stores, that is their ferritin measured on your blood test, are less than 20 micrograms per litre at the time of delivery, then studies tell us that the baby will also be iron deficient at delivery. The baby will take iron off mum only up to a point where the iron is available. Then we know that 1 in 5 children are iron deficient as a result of this. We also know that the studies tell us that iron deficient women find it harder to establish breastfeeding, so fixing the iron helps with that. And additionally, we know that we need some iron stores for delivering our baby. And lastly, having good iron stores helps improve postpartum mood and generally coping with what are many sleepless nights of having a baby. And it's far easier to do that if you have enough iron on board than if you've delivered your baby being iron deficient. The second part to all of this is, how do we fix iron deficiency in pregnant women? Because of the significant burden and the amount of iron required to run a pregnancy, oral iron or iron tablets really struggle to work during pregnancy. The iron needs are just far too great. Also, we know that 50% of all people who take oral iron are likely to get constipated. Constipation is already a big problem for pregnant women. We tend to really very much err on the side of having a very low threshold for giving pregnant women iron infusions, and realistically, during the second trimester or beyond, that is beyond about 12 and 14 weeks and beyond, we will routinely give women iron infusions because it rapidly fixes your iron stores. We have a lot of longitudinal experience from a safety point of view in giving women iron, and in our clinic we certainly do between 1,000 and 2,000 iron infusions in pregnant women every year and have done so for many years. It's also very effective in fixing the iron stores, and a lot of women will find that they feel better within 1 to 2 weeks. Lastly, if you're due to have your baby soon, you really need your iron fixed. Iron tablets take 4 to 6 months to exert their effect. Pregnancy having a fixed length, you really don't often have 4 to 6 weeks to fix your iron. So once again, many reasons for giving women who are pregnant iron infusions.